Hello. Welcome to Doc Talk Live. This is Brad Goodman, your host of Doc Talk Live. I'm with Mark DeGuenther. Hey, Mark.
Hey, Brad.
Appreciate you taking some time this evening to talk to us about the prostate. Mark is an old radio friend of mine. We both have the voice for radio, or what's it called?
No, it's called a face for radio.
The face for radio.
Yeah.
We both have the face for radio, and but now we've got to do this on Facebook, so we've actually got to get in front of the camera.
I don't know that I have a face for Facebook.
Yeah, I don't know either. But he is a urologist, and we're going to talk about the weak stream. Isn't that what you called it? People coming...
BPH.
They come in complaining of a weak stream. I always think about it, they get up 1,000,000 times a night to go to the bathroom,
right.
And it's not diabetes.
No. I mean, there's a whole bunch of symptoms that go with this. The thing that brings guys in most frequently is they have to stand there forever peeing, and the golfers say, I have to let the younger guys pee through, because they know what that means. But,
that's funny. Do you wear a white belt when you golf? I heard about this white belt thing.
I don't golf.
Okay, I don't either.
I play pickleball.
Okay. Do you really?
Spike ball, yeah.
Do you really?
Volleyball.
I have to pick that one up. All right, let's get back to the weak stream.
Anyway, so the weak stream, it takes them a long time to empty, getting up a lot at night. A lot of times their wives make them come in because the fellows will say, I get up 3 or 4 times a night. I go back to sleep, but their wives can't go back to sleep.
I
and
see.
They're tired of them getting up 4 times a night. Urgency.
What's causing this?
Well, as your prostate, let me show you a picture here. I think that's going to be a lot easier
I'm
at
going
this point.
to turn this around. Let me see if I can turn this around. Good, and I'll go this way now.
All right. So what we see, your bladder sits here. You pee out of your water channel, and your prostate sits right at the base of the bladder, and you pee through the middle of it. And as the prostate gets bigger, it compresses on the water channel. And this is a schematic showing that the enlargement of the prostate, and we're not talking about prostate cancer here. We're talking about just benign enlargement of the prostate that occurs. It compresses the water channel. Okay. And so what that does, we're done with that.
Okay.
Get back to me.
Okay, great. We'll get back to you. Get back to us.
What happens is that the
oh wow,
boy, technical. this is low budget.
This is it's good. This is perfect though. This is why I love this. This is going viral for sure.
Yeah.
Go ahead. I'm sorry, Mark.
So anyway, what happens is as the prostate has to, as it's blocking the water channel, the bladder has to squeeze harder and generate more pressure. And it has a hard time generating enough pressure to do that at times. And then the other issue is that the bladder is like any other muscle. It is a hollow muscle. And as that muscle has to work harder, it gets thicker. And as it gets thicker, it doesn't stretch as well. Normally the bladder is more like a latex balloon. Mm-hmm. But when it works hard, it gets thicker like a tire inner tube. And that tire inner tube stretches to capacity and no more. Whereas the latex balloon will stretch and stretch and stretch and stretch. That's what you want in a healthy bladder. But the tire inner tube bladder is that big thick-walled bladder. And when it gets full, man, they got to go. And that's what creates the urgency that the men say, I'm okay, but man, when I got to go, I better find a bathroom fast. It's because they just can't hold anymore.
Gotcha.
So there are a number of things we do to try to fix this problem. If it's bad enough for a man to seek treatment, then we can do treatment with medications. Most commonly prescribed are alpha blockers. Tamsulosin or Flomax are the most common of those.
Are those they work on blood pressure too, don't they?
Well, the alpha blockers that like Cardura or Hitrin, doxazosin, terazosin are blood pressure medicines that will have an effect on the prostate. The ones we use most commonly for the prostate are alpha blockers that are super selective for the prostate, and they don't cause the fall in blood pressure, which can be an unwanted thing in men who don't have high blood pressure.
So ultimately, there's a surgical. Is it a fix, or what would you call it?
Well,
is it a Band-Aid? Is it a stopgap measure?
I mean, the medicines will work for about 65% of people, mm-hmm. And when they work, for about a third of people they work in, they quit working after 2 to 3 years. For some men, they just don't work well, and then we need to look at some treatments. There are a whole bunch of different surgical things. I think the two that I use most commonly in my practice the transurethral vaporization of the prostate. A lot of guys have heard of a roto-rooter job. This is similar to that, except it's a more modern iteration of it. A little less bleeding, quicker post-operative recovery.
Are you going to show us
and
something?
I got a little video
All right,
here.
I'm going to try this again. I'm going to turn it around.
So, if you think of the prostate like an orange.
Hold on. Think of the prostate like an orange. Okay.
What we're going to do is, with our scope, go up in the middle of the prostate, and we're going to trim the prostate out. And this little thing is called a plasma button, and we're creating a really high electrical current right at the surface of the prostate.
I'm going to get even closer to this.
That is going to burn. Well, guess what? We're out of luck. Another technical snafu. So anyway.
Seriously?
Seriously.
There's no way of getting it back, huh? The remote connection was interrupted.
Yeah.
Amazing.
Maybe we will, but
all right.
Anyway,
I'll flip it back around. That's great. We'll have to do this all over again, okay?
Yeah. It's a good. Brad's right now. He's thinking, "Well, I'm glad I'm not paying him for this." So, anyway, we go up through the middle of the. If you think of the prostate like orange, and we use this really high electric current to burn the pulp out of the orange, but leaving the peel behind. Typically, an overnight stay in the hospital with a catheter. We get the catheter out the next day. Surprisingly, most men have no need for pain medicine at all after this surgery. And it will work for about 90% of guys.
You go up through. How do you get into this area? It's through the
urethra, through the penis with a scope.
And how do you not hurt the urethra?
Well, you burn out the lining of the urethra, and then it regenerates. It grows. It relines itself. The body has a remarkable ability to heal.
And what was the initial culprit for the prostate to start constricting around the urethra?
It happens with almost all men as they get older. We can prevent this if we castrate men and take away their testosterone, because without testosterone, this doesn't happen. But that's a real hard sell. Brad, would you like to be castrated to prevent this from being a problem in 20 years?
Not.
Okay.
Absolutely not. But do we all get BPH at some point if we live long enough? Like, we all get prostate cancer if we live long enough.
That's a little overstated, but yeah, everybody's going to get prostate enlargement. Every man who has testosterone. Now, if you're a member of the Vienna Boys Choir and you're a eunuch, you would not. But yeah.
Okay. What else anything else to say about this?
There's a couple other things that we do in the office that are short of this TUVP surgery. And one of them is called Resume. It's a steam injection where the advantage to that is you don't have to be hospitalized. You don't have to be put to sleep. We, again, go up through the water channel with a little lighted instrument, and we inject steam through, we deploy a needle through the wall of the urethra into the prostate and inject steam into the prostate. It disperses in the middle of the prostate, and you do several steam injections on each side, depending on how big the prostate is. That will cause that tissue to die, get reabsorbed by the body over a few weeks, and it works for about 80 to 85% of people.
Are there any complications with this procedure?
With the steam injection, most men need to wear a catheter for about 3 days because there will be swelling of the prostate which is going to completely shut the urethra down. Wear a catheter for 3 days, get the catheter out, and most men are going to pee okay again. They don't get a whole lot of improvement for 6 to 12 weeks because it takes that long for that tissue which has been killed to now be reabsorbed. There is something else that we do that's called urolift. The urolift procedure actually involves placing stitches through the prostate to open it up from the inside. And it's a non-surgical as far as we don't cut you open or do anything.
How about with the TURP? The
complication?
Yes.
Yeah, you can have bleeding. There can be some difficulty with urgency and frequency, symptoms worsening for a few weeks. The big thing that 75% of guys that have the TURP or the TUVP are going to develop retrograde ejaculation. That means that when they climax, nothing squirts out the end of the penis. It's going to go backwards into the bladder, mix with the urine, and when they pee, comes out dissolved in the urine. Now, that's not a harmful thing. It's not dangerous. It changes the sensation a little bit, but most of the guys who are, in the age that we're doing this, 65, 70, 75, 80 years old, the forcefulness of their ejaculation is not that great anyway, that's a normal decrease as we age. So it just doesn't seem to bother them.
Okay. Anything else our viewers should know?
I mean, and this topic is different than prostate cancer. Most men who come to the doctor with these symptoms are scared. First of all, they have prostate cancer. Prostate cancer usually causes no symptoms early on, and they should be screened for prostate cancer either by their primary doctor every year, starting at age 50 if they don't have any risk factors. But if you are African American or have a family history of prostate cancer, you ought to start getting screened at age 40. So that's something, if you come to see me with this, I'm going to make sure that it's happened, because we do want to make sure that we find those things if that's what's going on too.
When you get the bladder problems associated with the BPH, does that reverse itself once you fix the problem?
Good question. There is a point at which those bad urgency, frequency, urge incontinence, can't hold the urine. There's a point at which those things are still reversible, but there's a point at which they become irreversible. What I tell the patients is we don't know when that's going to happen, and it's variable. Some people can have these symptoms for a longer period than others, and it still be reversible. But when you're getting to the point where you're having more than a weekly accident where you can't make it to the bathroom and you wet on yourself before you get there, you're starting to do some damage. We need to get more serious about treatment, either with medicine or some type of procedure.
Got it. Mark, how do people find you? How do they find urology centers?
Are there any lawmen watching? Because if there are any lawmen, I don't know. Urology Centers of Alabama. Our phone number is 205-930-0920. If you Google Urology Centers Alabama.
Perfect.
Yep. Very good.
Thank you, man.
Thanks.
I appreciate it so much.
Bye-bye.
All right. Thank y'all. Sorry we were so shaky there in the beginning, but if you have any questions, just send them in to the show. Hit and finish.